month of February is usually referred to as Cancer Awareness Month. Despite several campaigns concerning cancer, many African women still come down and suffer one form of cancer or the other. What are we still not getting right in the campaign of cancer in Africa? To talk to us on this issue, I have with me Dr. Edusa Clement. You are welcome to the program.
Thank you very much, Olotoyin.
So, what exactly is cancer?
Well, cancer, as a lot of people know now because of the age of technology, is the growth of cells. Human beings are made of millions of cells which have different functions. So when a group of cells starts to grow uncontrollably and loses the ability to die, since all cells, some are born, some die, the loss of ability to die makes that cell mass grow into a mass, and that is what is called a tumor or a cancer. We have benign tumors and malignant tumors. So the malignant tumors are called cancers and benign tumors are just growths.
With your experience at the center, why will you think women will present late at hospital when they know fully well that it could be a death sentence to them?
Late presentation is very common, especially in our setting in Africa. There are a lot of, I would say, things which make people present late. Firstly, in our culture, when a person finds something which is abnormal, they tend to keep it to themselves. They tend to watch and hope that it disappears. If it doesn't, they tend to self-medicate. They further watch and see if the medicines help. If it doesn't, they, in most instances, actually go to see pastors and prayer camps before they actually present to the hospital. And when they present, it's usually late.
Now, let's assume a woman comes into the hospital with a cancerous lumps. What will be the next thing you do?
The doctor would tell the patient that the lump which was taken out is malignant. He will tell the patient what stage of the disease the patient is in and tell the patient what kind of medication or treatment the patient has to do. We usually have surgery as one option, chemotherapy, which is giving drugs to kill the cancer, radiotherapy, which is what we do here, giving radiation to the site involved to kill the cancer cells. So the doctor would usually speak with the patient and indicate which would follow which.
Well, I've often heard some doctors saying that cancer cannot be cured. Can you demystify this?
I don't think that is the right thing to say. Cancers can be cured, and in the West, that is America, USA, and other developed countries, they have a very high rate of cure. If you find cancer early, your cure is very, very high because it's a tiny amount of cells which can be excised and then that cancer is gone. If you present late, then you can actually say that yes, cancer cannot be cured because it's late, it's advanced. But even in late cancers, you tend to have a few people who miraculously cure from that late disease. And even as doctors, we are very surprised at such instances.
Will you say young people come down with cancer now compared to before?
Yes, it's what you've said is very true. We've seen that cancer has now become a pandemic. It's a worldwide phenomenon where the number of cancer patients is increasing on a yearly basis. The age group in which people get cancer is decreasing. So you tend to see younger groups now acquiring this cancer. And in the African population setting, it tends to be more younger and more aggressive than the counterparts with the whites who are outside. So it's very true what you said, that it's gradually getting towards the younger age group. And the younger age group are the working force. So it's something that we have to really stand up and fight and try and cure this scourge.
February usually is the Cancer Awareness Month. Do you think in Africa we are doing enough in terms of educating the populace on what cancer is and how to prevent themselves from getting this deadly disease?
I think it's a slow road to victory. We've started doing what it's supposed to do. I do agree that it's not enough. We can use the media, you can use newspaper outlets to send out that message. And most importantly, put it into the school curriculum, because if children start to grow and start to understand about diseases and all those cancers that can afflict them, they would grow up knowing about this disease and most likely prevent earlier or present earlier when that thing afflicts them. So I think education can be stepped up and in many various channels that exist already.
So as an oncologist, how do you think a woman can prevent herself from getting cancer, since even doctors like you said they don't know the causes of cancer?
My advice to women would be thorough self-examination. You as a woman grow, you know your body better than anyone. So with breast cancer as an example, you need to self-examine yourself. And usually that is examination of the breast and usually in front of the mirror. So the steps are: you stand in front of the mirror, you look at your breasts. They should look the same. If one looks bigger or if one looks dropping than the other, then there might be a problem. Then you use your hand to examine, to feel for anything. If you find any mass in the breast, which is not on the other one, then you need to report to the doctor, because that is where the disease would likely hide. Also, you need to examine your lymph nodes. Your lymph nodes are under your armpits and then on top of your neck. If you find anything which is round and which is not correspondent with the other side, it's also a telltale sign that there might be something which is harboring there. You need to tell the doctor. So it's self-examination. Apart from that, you need to do pap smears, you need to do mammograms. Pap smears find out whether you have cervical cancers. Mammograms find out whether you have lumps, lesions in your breast which you cannot palpate with your hands. So those things are some things which we don't do in Africa, routine medical examination, and that is why some of us present late.
Do you think we have enough well-equipped cancer centers in Africa?
I think cancer in Africa, in terms of facilities, is very, very understaffed and under-equipped. In the whole of Ghana, we have 3 oncology facilities which take. So 2 are in government, 1 is in private, that is us. And that's for a nation of 27 million. In Nigeria, as I understand, it's between 7 to 8 facilities for a nation of 170 million. Is just not enough. So it's something that we need to improve on. Unfortunately, such facilities cost a lot of money. It's infrastructure, it's training of staff. So it's something that needs to be spearheaded by the government to see that this is the priority and we need to have specialists in this field.
It has been so nice having you on the program today.
Thank you for having me.
Thank you very much. Well, you've heard our expert there. He indeed advised African leaders to channel more funds into cancer management centers so as to help women, especially to stop dying from any form of cancer. That's the program today. My name is Oluwatoyin Abo. Join me again next time. Bye for now.
Yeah.